And in the governor's coronavirus briefing today, he warned Hoosiers to brace for the projected spike in numbers over the next few weeks, which would include cases that developed after people traveled and gathered for Thanksgiving. He also talked about the impact the coronavirus continues to have on the state's nursing homes. Corinne Rose has the story.
Governor Holcomb and the state health commissioner said that Tuesday they told contact tracers in counties with a surge in COVID activity to prioritize cases from the past 6 days. State health leaders also shortened the script that tracers use when they call people who've tested positive and said in one day that move significantly cut down on the duration of phone calls as well as time that people spent on hold. Contact tracers are also now supposed to encourage positive patients to call their own close contacts.
If you're positive, think about who you have been in contact with within 6 feet for 15 minutes or more in a day. Let them know immediately that they may have been exposed and that they need to quarantine. Point them to the many resources on our coronavirus.in.gov website that explain what isolation and quarantine look like and how to do that in your home.
You isolate if you test positive and quarantine if you've been exposed. The Centers for Disease Control changed its guidelines Wednesday, saying you can now end your quarantine after day 10 instead of day 14 if you have not had a test and do not have any symptoms. However, you can end your quarantine after day 7 if you test negative on days 5, 6, or 7 and have no symptoms. The first people to get the coronavirus vaccine in Indiana will be frontline healthcare workers, as well as staff and residents of nursing homes. Last month, Governor Holcomb mobilized 1,800 members of the Indiana National Guard to help with administrative and sanitation work at nursing homes across the state. One of them joined the briefing from a facility near Muncie, saying her time there has opened her eyes to how tired healthcare workers are.
Now that we've been here for a few weeks and you see, how little it feels like we're doing, but how big of an effect it has, it really does put things into perspective because even, if you have a guardsman here taking a temperature, it means that there's a technician that can go help take care of residents that are really sick.
More of the state's plans to distribute vaccines will be outlined next week. Corinne Rose, ABC 21.